You know, every single year, thousands of men are living with a silent threat inside their bodies. It's a disease that often doesn't show any symptoms at all in the beginning, which you can imagine makes it way harder to treat down the road. So today, we're going to break down the crucial warning signs of prostate cancer that you just can't afford to ignore. To really get a sense of the scale here, let's just start with one single statistic. 1 in 8 men, 1 in 8, will be diagnosed with prostate cancer in their lifetime. I mean, that number alone really tells you how common this is. But that one statistic, it doesn't even begin to tell the whole story.
Because here is the most important number I want you to remember today: 98%. That's the 5-year survival rate when prostate cancer is caught early, when it's still localized. And that is exactly why knowing the signs isn't just, good information. It's a powerful tool that can literally make all the difference in the world.
So this brings us right to the main event, the central question. What are the signs you absolutely need to have on your radar? Let's walk through them, and we'll start with the nature of the disease itself. Okay, first, let's get a handle on the nature of this disease. I mean, why is it so often a silent threat? What's going on here?
So what is the prostate exactly? Well, think of a small walnut-shaped gland. Its main job is to produce the fluid in semen. But its location, wrapped right around the urethra, that's the key. That's precisely why it can cause such specific urinary symptoms when something starts to go wrong.
Now, this is really critical to understand. Not all prostate cancers are the same. They don't all behave the same way. Some are super slow growing. They might not cause any real problems for years. But others, they're aggressive, and they can spread fast, becoming seriously life-threatening. This is why catching it early is so vital. You have to understand which type you might be dealing with.
Okay, so what are those first signals? Let's really zero in on the early, often subtle, warning signs. The kind that are just all too easy to brush off or ignore.
Let me just ask you a question, straight up. Are you finding yourself waking up over and over again all night long to use the bathroom? Because this is one of the most common early red flags.
See, because the prostate gland literally surrounds the urethra, a growing tumor can start to press on it, and that causes all sorts of urinary issues. The number one complaint is a frequent need to go, especially at night. That's a condition called nocturia. Other early signs you've got to watch for are things like pain during ejaculation, seeing blood in your urine or semen, or even just a persistent discomfort when you're sitting down.
I want to pause on this one for just a second. Seeing blood in your urine or semen, I mean, that can be pretty alarming, and for a very good reason. While yeah, other things can cause it, when it comes to prostate cancer, it can be a direct result of a tumor growing. This is one symptom you should never, ever just ignore.
All right, now we need to shift gears a little and talk about the more serious signs. These are the alarm bells, the signals that tell you the cancer might have advanced and spread outside of the prostate itself.
When prostate cancer spreads, it often goes to the bones first, and this causes a very specific kind of pain. This quote here really nails it. Unlike typical muscle or joint pain, this discomfort doesn't improve with rest. It's not a sore muscle. It's a deep, persistent ache that might actually get worse over time.
And beyond that deep bone pain in your back, hips, or chest, other advanced signs include things like swelling in your legs or feet. That can happen if the cancer cells are actually blocking your lymph nodes. Unintentional weight loss is another huge red flag. Cancer cells just consume a massive amount of energy. And maybe the most urgent sign, numbness or weakness in your limbs. That could mean the cancer is actually pressing on your spinal cord.
So we've covered the symptoms, but it's also super important to understand your own personal risk. I mean, not everyone's chances of getting prostate cancer are the same. As you can see here, age is the single biggest factor. Your risk just shoots up after you turn 50. Race also plays a big role. We know that African American men face a higher risk. And family history is absolutely critical. If a close relative, like your father or brother had it, your own risk can double. And that risk also goes up if you have a family history of breast cancer, which can be linked to similar genetic mutations. And finally, yeah, lifestyle factors like obesity and diet definitely matter too.
Okay, so with all this information, what's the big takeaway? It's not about being afraid, it's about feeling empowered. This last section is all about hope and the proactive steps you can actually take.
Look, you can't change your age and you can't change your genes, but what you can do is take control of your lifestyle. That means focusing on a balanced diet, getting regular exercise, and, most importantly, it means talking to your doctor about screening. This usually involves something called a PSA blood test, which measures a protein made by your prostate.
Just think of these steps as your best possible line of defense. Ultimately, this all boils down to a pretty simple choice. Knowing the signs, understanding your risk, and taking action, that's what puts you in the driver's seat. Your health is in your hands. So the only question left is, are you ready to act?